Hi, my name is Dr. Courtney and I'm here to show you a few tips and tricks to get through your pregnancy with less pain. Number one, what we're going to do is we're going to start out with a pelvic rock. So anytime we sit, we want to start by taking a seat and finding our neutral pelvis. What that means is we're going to let our pelvis drop back, so kind of like we're going to be slouchy. The next step we're going to do is we're going to take our hips and we're going to rock forward, just like we had a big dinner and we're sticking out our bellies. From here, we're going to find the neutral pelvis, and we can also turn this into a pelvic rock. So this can be number one, to find a good, safe seated position. Number two, we can use this to get some more motion and mobility into our pelvis. So what we're going to do is drop back into that kind of slouchy posture, and then we're going to rock forward into that little bit of overextension. We're not going to go to the end range because we do want it to be pain-free all through these motions. So from here, exercise number one, you can do this now 5 to 10 times, just really getting a little bit of a feel for that opening of the hips here. And number two, when we're ready, we can find somewhere sort of in the middle that feels nice and comfortable, so that we feel like our spine is just kind of sitting on top of itself naturally without any pressure forward or backwards. The next beautiful stretch that we can throw in here for any pregnancy-related low back, SI, or hip pain is going to be the figure 4 stretch. So this stretch is going to stretch these muscles in the side here. So that's that glute med, that piriformis muscle. These are the muscles that are going to get really tight if they are weak going into pregnancy. They're going to try and support that pelvis as we start to shift through the pregnancy. So what we can do here is give that a little bit of relief, so it's not irritating on the sciatic nerve or causing any discomfort or imbalance throughout the rest of the pregnancy. Once we find that neutral pelvis, we're going to have our legs slightly apart, whatever's comfortable for us, sitting at about a 90-degree angle with our hips and our knees so that we're comfortable. Next step is we're going to take one leg and we're just going to put that ankle gently onto our opposite knee. From here, we're not going to be putting pressure on the knee. That's unnecessary. All we need to do here is gently do that forward rocking of the pelvis. We're not going to let our bodies fall back like this. We're not doing any slouching. Nice neutral pelvis and that little tip forward. We should be able to feel a nice big stretch through this area here. Again, any of these stretches should be pain-free. We can hold that for about 10 to 15 to 20 seconds, whatever feels comfortable, and then we're always going to switch and do the opposite side. So again, ankle gently on the knee, no pushing here. All we're going to do, find our neutral pelvis, and we're going to slightly rock forward at the hip. And you'll feel that really nice, yummy stretch right through that whole lateral side of the leg, sometimes even a little deeper. Again, there should be no pain anywhere in the body while we're doing this. Enjoy!